Hey there. Thanks for joining me for an early morning chat today. So, today we're going to be talking about what a pharmacist's role in fighting health misinformation is. Um, for a part of this, I'm going to be speaking from my own personal perspective as a student some years back going through pharmacy school. Understanding that it is my perspective, I also know that some of this might resonate with you and your experience, whether as a pharmacy student or a pharmacist. So when I was in pharmacy school, I got the sense that patient education, health education, drug information, etc., were critical aspects of a pharmacist's role. Um, we had classes on communication and how to counsel patients appropriately and all of the things. We would always talk about patient counseling and motivational interviewing, et cetera, all the things. But what I found as I kind of moved through the program and saw more examples of pharmacy practice in real life is that in a lot of settings, especially in community settings, there is still an expectation for pharmacists to be able to educate patients, but there isn't always the infrastructure or the time for pharmacists to be able to do that. So while theoretically we are well prepared to and expected to be integrating patient education and information into our careers, in reality, it doesn't always turn out that way. The ways that we might do that are through like patient counseling, providing advice if a patient asks you a question, providing maybe written or visual materials that the patient can take home with them to help them in that setting when they're no longer at the pharmacy, but might still need a little bit of guidance. But again, there are limitations on how much we can actually educate patients. You might not be engaging in patient education as much as you may have expected to back when you were a student pharmacist or were, an intern or anything like that. Um, but that doesn't mean that we are not a subgroup of the professionals who should be leading this work on patient education, particularly when it comes to health information and drug information. So then the question becomes, okay, well, if we are well qualified to do this, well prepared to do this, we just don't have the time to do it in our actual roles, then how do we actually utilize these skills that we have for the benefit of the public health, right? And so one of the reasons that I decided I wanted to be a public health pharmacist is because I wanted to make sure that in whatever types of roles I had, that I was having a broad and wide scale impact. And another way through that journey of acting as a public health pharmacist, I realized that another way of embracing that skill set of patient education and health information and countering health misinformation could be achieved through health content writing. And as I've told this story many times before, but I didn't realize that this was a thing until I kind of stumbled upon it. And I know that a lot of you are in that same situation as well. Um, if I had to briefly give a definition of health content writing and for deeper explanations, I would encourage you to check out my Health Writing for Health Professionals YouTube channel or to attend the Health Writing for Health Professionals workshop that I'm going to be hosting tomorrow at 8 Eastern Time, where I'll be diving deeper into the definition of health content writing, how it fits in with health content marketing, etc. But for now, for anyone who doesn't know, health content writing is basically a way of creating content online that is informational and educational. And the purpose of that content is to help a person solve a health problem that they might have or answer a health question that they might have. So when you go to Google, for example, and type in like, um, can I take Claritin on an empty stomach? And the articles that show up, those articles are oftentimes examples of health content writing. And so obviously, with that example, you can see how impactful the health content that shows up online is, because people are taking what they're reading a lot of times at face value. And so if they see a particular suggestion or a comment or a thought in one of these articles that's coming up when they search for a when they search a health question, that they might very well might act on that information like in their real lives. And so it's really important to make sure that there is accurate health information out there, because otherwise we all know very well that there is a litany of health misinformation that people can easily come across. And so this is one of the reasons why I believe that more health professionals, pharmacists included, should be health writers, because I believe that we are the ones who have this training and have this expertise and the training in communicating this information to the general public and to people who need it. And so we should be able to really leverage that skill more than we are right now. So again, if you're looking for a way to kind of expand your ability to fight health misinformation by doing more health education and patient education, I think that it's worth considering freelance health content writing as a powerful way to do that. In addition to, whatever work you're currently doing in your traditional career. One of the nice things about freelance health content writing is the flexibility of it. And so for me and a lot of other freelancers out there, you're able to kind of still do your primary work while also kind of supplementing what you're doing with some different and more creative opportunities that allow you to get more of that patient education time in than you probably have in your traditional workplace. So again, tomorrow I'm hosting the workshop that I mentioned. It's the Health Writing for Health Professionals 102 workshop. And it's for health professionals who are interested in learning more about what health content writing is, especially in the broader context of health content marketing. We're going to also be practicing some of the foundational skills that you would use as a health content writer, just so that you can get a sense of how it's done, right? And how some of those things feel, and also help you get a clearer idea of whether or not freelance health content writing could be a good path for you. So I encourage you to register today if you have not. Again, the workshop is tomorrow at 8 p.m. Eastern time. If you've watched any of my videos over the past couple of years, or attended the Health Writing for Health Professionals 101 series that I did as a part of the LinkedIn Creator Accelerator program, then attending tomorrow's workshop, Health Writing for Health Professionals 102, is going to be an excellent next step for you. So I hope to see you there. I will leave the registration link in the comments, and we'll talk soon. Have a good day.